Hello, I am Martin Gomez and I will be discussing cervical caps. What is a cervical cap? A cervical cap is one method of birth control. The cervical cap is a silicone cap that is inserted into a woman's vagina and over her cervix. Mechanisms of action are intended to prevent pregnancy, and what I mean by that is it is intended to prevent pregnancy by keeping sperm from joining with an egg. Used with spermicide, the cervical cap must be used with spermicide jelly or cream for it to be most effective. These caps work in two forms. Cervical cap blocks the opening to the uterus is one way, and the second way is the spermicide is to help keep sperm from moving. Instructions for use. First, one must wash their hands with soap and water. Next, they would put a 1/4 teaspoon of spermicide in the dome of the cervical cap and spread a thin layer on the brim. The next step would be put a 1/2 teaspoon in the folded area between the brim and the dome. Next, they would have to find a comfortable position. Some of these positions can be from standing with one foot on a chair, to sit on the edge of a chair, or to lay down, or to squat. Then they must put their index and middle finger to locate their cervix. This is so the female will know where to place the cap. Then they must separate the labia with one hand and squeeze the rim of the cap together with the other hand. Slide the cervical cap dome side down into the vagina with the long brim entering first. Then they must push down toward the anus and then up and onto the cervix. Make sure the cervix is completely covered. And some rates that we have on cervical caps is when they are typically used on average, it prevents pregnancy by 10%. So 10% of the time a female could still be pregnant even though they use a cervical cap. And if they use the cervical cap perfectly, it can reduce that percentage down to 4. Now, if the female has already had one child, the cap would be less effective and increases their chance of still getting pregnant by 29%. Some of the cost of these, first they would have to get an examination by a health provider, which could be a doctor or a clinic, and the examination itself runs anywhere from $50 to $200. After that, they would get a prescription and they would go down to a drugstore to purchase a cervical cap, and that price could range anywhere from $60 to $75. And the spermicide jelly or cream that is used with the cervical cap can range from $8 to $17. Some of the advantages and positive side effects are: it lasts for up to 2 years, it is safe, effective, and convenient. Cervical cap is small and can be carried in a woman's pocket or purse. It generally cannot be felt by the woman or her partner. It has no effect on a woman's natural hormones, and it protects against pregnancy for up to 48 hours. Some of the disadvantages and negative side effects: it cannot be used during menstruation. It may be difficult for some women to insert the cervical cap. At times it can be pushed out of place by some penis sizes, heavy thrusting during sexual intercourse, and also by some certain sexual positions. Women can also develop vaginal irritation, and these can be due to allergies to the spermicide jelly or cream, or discomfort or pain when using the cervical cap. If the cervical cap is used longer than 48 hours, women can be at risk of toxic shock syndrome, unpleasant vaginal odor, or unpleasant vaginal discharge. Protection from STIs. You against chlamydia or gonorrhea, but it does not protect from STIs. It does not protect from HIV or herpes. Some of the ways to obtain the cervical cap: a woman would have to set up an appointment for an examination by either a Planned Parenthood health center, a clinic, or a private healthcare center. And they would have to get this examination by a doctor or physician, and they would then get a prescription and with this prescription they go down to either a drugstore or a clinic to purchase this over the counter. And that is it. Thank you very much.